With the arrival of flu season here in Central Florida, we've also seen an increased number of patients coming into CentraCare with pneumonia. Now, pneumonia is a bacterial infection that will typically follow an influenza infection. So you come down with the flu virus, you get a cough, runny nose, sore throat, high fever and body aches, and that virus really does hammer away at your immune system, and a lot of phlegm and mucus building up in the airways, causing that bacteria to be able to take advantage of the situation, cause an infection, bacterial infection down deep in the lungs. Pneumonia can be hard to distinguish between the symptoms of influenza because a cough and fever could be influenza or it could be pneumonia. But indicators you need to get in and get it checked out, get a chest x-ray, because a chest x-ray is the best way to tell if you have pneumonia, is if you have an ongoing cough that's not resolving after several days, any difficulty breathing or shortness of breath, you immediately need to get that checked out by a doctor. Or any chest discomfort when you cough, if you're having pain when you breathe, pain in the chest, get that checked out immediately. A simple chest x-ray can tell you whether it's pneumonia. If it's a bacterial pneumonia, needs to be treated with an antibiotic. Influenza is a virus, so it's treated with an antiviral like Tamiflu, so it's a little different treatment. But fortunately, with the antibiotics we have nowadays, they're very effective at treating pneumonia. In the old days, everybody went in the hospital if you had pneumonia. The only people we put in the hospital now are people at high risk of complications, people with heart disease, older people, or people who are having difficulty breathing. A very bad pneumonia would have to be placed in the hospital for IV antibiotics. But oftentimes an oral antibiotic is all it takes to get rid of the infection.